I'm Cynthia Oswald. I'm the director of the foundation here at Noise Health. I just am going to go over our plan. I think we're on plan F now, but the plan for this morning. Glad you all found us down here. We thought a tent outside just wasn't going to work. So we have our reception here. We have lots of food to hold us over. We have good friends and colleagues here to celebrate. We're going to have some speakers. And then those of you that would like to join us upstairs, yes, outside, for the groundbreaking. We're very close to a canopy. It won't be that bad. We did this once before for the Mary Saunders Bierman Emergency Department, and as Amy says, it's good luck for us, so we like it. If you want to remain down here while we do the photo shoot upstairs, you're welcome to do that. We will continue to replenish the food. And the folks that come up for the photo shoot will come back down for the reception. And we're also going to have a young man here from Wayland Cohocton Schools that has a check for us. So we're going to do a little presentation. So thank you again, and at this time I would like to introduce Noise Health President and CEO, Amy Pollard.
Thank you, Cindy. Well, here we are again. And we've decided that rain and wind is now our signature anytime we have a groundbreaking at Noise, so get used to it. So good morning and welcome to Noise Health. I want to thank the press and all of our guests for being here with us this morning for the Ann and Carl Myers Cancer Center groundbreaking event. We have some representatives here with us today that I would also like to acknowledge, and I'm going to have you raise your hands so people know who you are. We have Mary Green from the office of Tom Reed, Congressman Tom Reed's district. Thank you very much, Mary, for being here. Chris Catt or Michael Crocker from Congressman Chris Collins' office. Are they here? Back there, thank you. Jim Culbertson is here, I saw him for sure, and he is representing Senator Kathy Young. Barb Collins is here representing Assemblyman Bill Nojay. You're here, I know. Barb, where are you? Back there, thank you. We also have Dr. Mark Taubman on my right, and Dr. Taubman is the CEO of UR Medical Center and the Dean of both the Schools of Medicine and Dentistry at the University of Rochester. And did Steve make it? Is Steve Goldstein here? No, Steve is on his way. Steve is on his way, and trust me, you'll know when he's here. Steve is the president and CEO of both Strong and Highland Hospitals in Rochester. Well, the construction fences are up. The heavy equipment has arrived. There was supposed to be a crane here today, but when the wind is over 20 miles an hour, the crane does not operate for good reasons. We didn't really want that kind of press. And there is definitely a sense of excitement in the air. I am very proud to be here today along with my colleagues, Eva Benedict from Jones. Eva is the CEO at Jones Memorial in Wellsville. Dr. Jonathan Friedberg, who is the director of the Wilmot Cancer Institute. And Ann and Carl Myers. And all of you to officially break ground on a regional cancer center based here at Noyes Hospital in Dansville. The collaboration of UR Medicine's Wilmot Cancer Center, Cancer Institute, Noyes Health, and Jones Memorial Hospital on this cancer center will strengthen and expand oncology services available in this region. This project includes, here in Dansville, a 4,500 square foot lower level renovation and addition to house a radiation oncology clinic. Also a 2,300 square foot medical oncology clinic in renovated and additional first floor space that will feature 3 exam rooms and 5 chemotherapy infusion bays. The Ann and Carl Myers Cancer Center will bring patients access to services including diagnostic testing, clinical trials, outpatient palliative care, and Wilmot Cancer Center's Institute's Judy DiMarzo Cancer Survivorship Program. The project has an estimated cost of a little over $5.8 million. In addition to the Myers family gift of $2 million, each hospital system, so that's Noyes, Jones, and the Wilmot Cancer Institute, each of the three of us have agreed to contribute to this project in either equipment or funding $1 million each to make this program a reality. We will continue to look for opportunities to cultivate donors in our communities to fill the gap for the project. We have already seen an outpouring of generosity for this project in both the Dansville and the Wellsville communities. And in Dansville, we've seen a lot of support from the Kyle Button family. The historic collaboration will expand access to quality medical and radiation oncology services for years to come, as well as support the mission of all three organizations to improve the health of individuals in a compassionate and caring environment. We're very excited to have this partnership bring cancer care close to people and their families. And now I'd like to introduce Eva Benedict, who is the CEO of Jones Memorial Hospital.
Good morning. Thank you, Amy, and thank all of you for joining us today. What an exciting project this is for our region. Already the partnership between Jones Memorial, UR Medicine, and Noyes Health has improved access to cancer care for our community, and today we celebrate the next step. Since September, Dr. Brian Smith has been seeing patients in the medical oncology clinic at Jones Memorial. He brings the expertise in cutting-edge therapy that the Wilmot Cancer Institute is known for to the patients in Allegheny County, saving them the trip to Rochester. Once construction on the Ann and Carl Myers Cancer Center is complete, the nearly 600 people that travel annually to Rochester to the Wilmot Cancer Institute will also have access to radiation oncology and infusion services in half the distance they currently travel. It will be available here in Dansville. This project is an example of how important it is for rural hospitals and health centers to form partnerships, working together to bring specialty care to our patients and fill their needs closer to home. By collaborating on this project, we are accomplishing just that goal. In closing, let me say how proud we are at Jones Memorial to be a part of this project. All of us at Jones, Noyes, and UR Medicine share a commitment to bring outstanding quality of care that the Wilmot Cancer Institute is known for to all of our communities. Thank you very much for attending today, and we're truly grateful for your support. Now I'd like to introduce Dr. Jonathan Friedberg, who will be our next speaker.
Thank you, Eva. Thank you, Amy. And I'd really like to thank the entire Dansville, Wellsville, Hornell communities for their wonderful support. Today's groundbreaking, I think, is the beginning of the construction of the Ann and Carl Myers Cancer Center. It's a major step toward ensuring patients from this entire region have access to the highest quality cancer care. Caring for cancer patients is more complex than it has ever been. It often requires between 5 and 10 physicians and a completely integrated system to bring together surgery, radiation oncology, medical oncology, palliative care, molecular diagnostics, and all other components that make cutting-edge care. And that's what we're seeking to develop here. And this facility is going to allow us to do that in a unique way through this partnership that has already been described. I'm excited that we're already seeing the impact that this project has had on families and patients in this region. Brian Smith was mentioned. He's here at Noyes, as well as going down to Wellsville. He's already provided care to 500 patients this year, 1,400 visits this year in this region. And this is just as we're beginning to create the program. We have UR Medicine Radiation Oncology in Hornell right now. with Dr. Chowdhury, who's here with us today, sharing an office with Dr. Sharda, who's also here with us today. At the Radiation Oncology Center, we're projected to treat 120 patients with 3,000 radiation treatments this year. And the idea is that we're developing these programs so that when we open the facility, it will be full, and we will have vibrant practices to bring into that facility. I just want to really close in saying what a delight it's been to collaborate with the other members of this team, Amy, Eva, and the leadership at both Noyes and Jones Hospitals. It's been a fantastic partnership, and I think that's why I'm so certain this will be successful, because of how well the partnership has gone to date. And I'll introduce my boss, my CEO, Dr. Mark Taubman.
Thank you, Jonathan, and thank all of you for coming today. This really represents, I think, two groundbreakings. One, a very literal one, where we'll put some spades into the dirt. And I have learned, I think we've had the same experience, that almost every time we have a groundbreaking at the university, it rains. If one looks at the recent Golisano Children's Hospital, one can only conclude that that's a very good sign. But this is also a groundbreaking, for really a novel approach in how to provide the highest quality care to a region. And that's a challenge which is not at all unique to the Southern Tier. It's a challenge that's occurring around the country. And I think, as Jonathan mentioned, is a particular problem when you have something as complex as cancer. This is a very large region that in area with a relatively small population spread over multiple towns. And as Jonathan said, cancer care now has to become more comprehensive. It has to include the ability to do surgery, the ability to do radiation therapy, the ability to do infusions. We are fortunate we're in an era where we now talk about survivorship, but that becomes even more important because it is our hope that we will mostly be talking about survivors. And there's more to come. We really are only at the beginning of what will be a revolution in cancer care, something that keeps changing its title. We're now calling it precision medicine. But as we understand more about the genetics of cancer and the genetics of the people who have cancer, what we're looking for ultimately is to be able to treat each individual based upon the specific tumor and their specific genetics so that we know what works. That requires a very coordinated approach, and an approach that's really too expensive and too sophisticated for any one center to do it. We have some wonderful facilities, as Jonathan mentioned, in Hornell, in Wellsville, in Dansville, but it is hard to put this all together, and really what this Cancer Center will do is provide a hub that allows us to coordinate this, taking advantage of the assets that we have in each community, but adding to that in order to make sure that we can provide every person in the Southern Tier with the state-of-the-art cancer care. The state-of-the-art that never requires them to leave Western New York, and ideally to leave their communities to receive it. I think we all know that that's particularly trying in cancer. If you have a loved one who needs to have an infusion and radiation therapy every week, it is a lot better having them locally than having to drive up to the University of Rochester. So I think that not only does this provide us the ability to coordinate care and really demonstrate a national model for how you do this, but also make it much easier for the patients and families to stay local, to stay with their physicians. So to me, this is as exciting a groundbreaking as the actual hole in the ground. But without further ado, let me please introduce Ann and Carl Myers. Without them, this would have been a very difficult undertaking. So thank you for your generation, and thank all of you.
Well, thanks again for all you folks coming, and Ann and I have been very happy with the response that we've had on the street about what is going to take place here, and I'm overwhelmed with listening to what this is going to mean to the area. And we're very fortunate that Ann and I could be part of this, and all I can tell you is I don't see anything negative here. And that's wonderful to say after spending, a couple of $1 million and can't find one thing. So there again, I'll end with that, and we're all looking forward to this ribbon cutting. I guess it's going to be, maybe a year or two. But anyways, it's been a long time coming, and I just appreciate the help that we've had from the surrounding areas and the doctors and everything else that makes this going to be a very workable thing. So anyways, with that, we'll end, and I guess we got to go up and shovel some dirt.
No, still coming?